All right, and we're live. Hey, everyone. This is Carlos, aka CJ, and want to welcome everyone to a Gadfly Newsbreak live stream. If this is your first time tuning in to the Gadfly, we are a multi-channel network platform, meaning that we have several great contributors who can put out a lot of great content to our site. So we have Dr. Jim Willie. We also have London Paul of the Sears Report and also Ken Shortgun Jr. of Shotgun Economics. So check us out. Go to the gadfly.vhx.tv where you can learn more about our premium subscription-based system. And today I have with me Ken Shortgun Jr., who is the editor that you can find his site, which is Shotgun Economics. Puts out a lot of great content there, as well as the Gadfly. So Ken, happy Wednesday afternoon. How are you, sir?
Good. Doing well. Looking forward to tomorrow for the NFL draft, the first real live sporting event in a month.
That's about it. And I guess it's virtual. So they were saying that they didn't have to order all the fancy suits and get all glammed out for this one.
Exactly.
Well, Ken, I want to thank you for jumping on today. And the title to this live stream is asking some questions in regards to COVID-19. And you're like me, I think, in terms of the Gadfly and how we're really looking, forward with this, the COVID-19 that's happening. But we also want to share there's some great research that's happening currently. And interesting enough, an article actually came out today, Ken, from California based, asking the questions that was the coronavirus death in California came weeks before the first known U.S. death, and this is dating back to February 26th. Now, leading up to this, I had previously been doing just a little bit of research, just a little bit of reading, and by no means is this broadcast attempt to finger point or to jump too far into theories or conclusions. This is just basically sharing kind of research, Ken, that's taken place. And what really kind of started this off was a great podcast / interview that Del Bigtree did on his platform, The Highwire. So I thought for our audience, we could kind of walk through this today and then pause it during key times to discuss, some of the information. And this is covered under fair use. We are going to provide some commentary in regards to this video. Anything you want to add to that, Ken, before we jump into it?
The one thing I want to add is there are a lot. And the one thing, we've talked about a number of different or the COVID-19 a number of different times. Each of the contributors actually has a baseline of agreement, but we also have information and research that because there is so much misinformation, the Pompeos of the world are trying to use it as a means to start a war. China is locking down media. They don't want to know what the truth is. They're holding back a whole ton of stuff when it comes to information. So really what is happening is as we get bits and pieces of confirmed stuff, it's evolving. So we didn't know what we've talked about in the podcast before has not been the absolute truth of a matter. It's been to the evolved point of the information that's out there and what we get from our contacts. And this video, one of the things that it does is it unlocks the ability then to go research back and to see if it was something that not necessarily was planned, but the aftermath and what is being the agenda and narrative that is being now by certain individuals was planned, knowing that this was going to hit the world as a pandemic. So that, to me, I've got some articles as well, some really key information, and all you have to do is go back to Netflix in December. A joint Obama, Bill Gates documentary called Pandemic came out just before this started to really hit.
Yeah, and then real key into it, in regards to this interview that Del did, is speaking specifically with the aftermath and what we're dealing with, and why it's important that we establish this foundation is primarily so that we can learn from this current COVID-19, what's happening right now with this, and apply it to future, potential pandemics and things that are happening. I think we need to be documenting our key findings along the way, because right now I agree there's so much speculation. So this is a theory that's transpiring right now. There is research currently going on in regards to asking just point blank, did you already have COVID-19? So let's go ahead and go with it, Ken.
Okay.
All of these numbers, they get tossed on their head with a discussion that we're starting to hear all over the world right now. So many discussions, doctors in Italy saying, we were treating patients, all the way back in November, that had this illness we couldn't describe. And now I believe that might have been COVID-19. We're starting to see articles about that. There was an article out of the Los Angeles Times that was referencing the fact that, looking back, new signs suggest coronavirus is in California far earlier than anyone knew. In this article, they end up saying it could go back. The virus was freewheeling in our community and probably has been here for quite some time. Dr. Jeff Smith, a physician who is the chief executive of Santa Clara County government, told a study out of Stanford suggests a dramatic viral surge in February. But Smith on Friday said data collected by the Federal Centers for Disease Control and Prevention, local health departments, and others suggest it was a lot longer than we first believed, most likely since back in December, describing flu-like symptoms, something they couldn't explain all the way back in December. Is it possible that we had COVID-19 before it was even announced in China? Is it possible that this virus was all the way back in the last flu season that started in the fall? Now, remember, if we were going to follow that hypothesis, then the hypothesis would have to be proved out by some sort of jump, right? What we would do, I suppose, is look at the flu rates we've seen every flu season over several years and then see, is there something even on top of that that went even higher that would have added to those flu numbers, perhaps last fall? Well, that's exactly what this article that appeared in Medium magazine for just a moment before it got pulled. Do we have that headline? Evidence suggests that COVID-19 was here in November. That was by AJK, and she worked with co-author and contributor Dr. Thomas E. Seeger, PhD. I got a chance yesterday. He did the modeling on this and looked into this and backed up this article. I sat down and got some time out of his busy schedule to talk to him about this really outrageous theory. And let me point out, it's a theory. I know Facebook's going to say false information across this, but I think we should be allowed to investigate things. And for those of you that are new to the High Wire, the investigation happens before your eyes. I want you to know what scientists are looking at right now, and scientists all around the world are asking this question: is it possible this started earlier? And what does that mean to our modeling? It's my honor to bring on to the show Associate Professor, School of Sustainable Engineering at Arizona State University, Professor Thomas Seeger. Thank you for joining us.
It's my pleasure.
To begin with, obviously we're all living in the same world right now. We're in lockdown around the world. You, just like I and everyone else here, have been watching discussions on our television about the imperial model and, seeing these predictions for, incredible rates of death around the world, and those models shifting down. And then, of course, discussions about, whether or not Trump started on time with our reaction. From your perspective, when did you start questioning, I guess what we were hearing about is sort of the scientific modeling or the numbers that were coming out? What started raising flags for you, and when do you think that was?
It's when I got a call from AJK. She's a friend who was thinking about her liver tumor, the fact that it's inoperable, at least right now, and she needs continuous monitoring. It's time for her to go back and get a 6-month scan to see if her tumor is growing or shrinking. Because the liver is full of blood vessels and she has a history of a bleeding disorder, it makes a biopsy or a removal very dangerous. Rather than cutting her liver open, the doctors went right up to the tumor board and they said, the best thing we can do is monitor this. She can no longer get that scan because all of the elective procedures are shut down in the state of Arizona and many other states. I didn't understand what an elective procedure was and why it would include something like getting a scan of a potentially lethal liver tumor. It turns out that the opposite of elective is emergency. If you have an emergency, you still have access to healthcare in our state, in Arizona, and in other states as well. Everything that isn't an emergency or COVID, as a first approximation, is shut out of the healthcare system. And this concerned her. So we began talking about the curve, the timeline, speculating about when would the case rates bend down in a way that might allow reopening the healthcare system. That's when she got on the Center for Disease Control data site and got really curious about when COVID may have shown up in the United States. There's a lot of speculation about it, and her speculation turned into research. When you do look at the CDC data, you find that there was an increase in influenza-like illnesses. So these are people who are reporting symptoms of the flu that correspond with the symptoms of COVID. And they started back in November of 2019. So AJK asked me to take a look at this data together and say, is it possible that COVID came early? We started doing some science, and I explained that the way hypotheses work is you start with an idea and then you do your best to disprove it.
Right.
In this case, if COVID came early, then we have to see that in the CDC data. If there is no indication of a surplus number of influenza-like illness reports in November and December, then that invalidates the hypothesis. We took a look.
The idea being, of course, that COVID would be sitting on top of the normal flu numbers that we see. We would have to see, a larger or an increase in what would be the average flu season, correct?
You've got it right, Del.
Okay.
The sitting on top is a good way to put it. When she pulled the data and she began to compile it by week, she saw that in every year, there are unexplained flu-like illnesses. It's customary for doctors to report a flu-like illness, to take a swab, to send it to a clinic for testing. The CDC monitors at least 6 different strains of seasonal flu. And every year, there are thousands of cases a week that can't be explained. But when she got to November and December of 2019, it was tens of thousands of cases a week. So compared to 2017, which was a terrible flu season, 2016, we looked at more years, but we only printed up the last 2. Tens of thousands more people a week coming to their doctors and saying, I don't feel well. I have a fever. I have a cough. These are the symptoms that are consistent with COVID. But nobody knew in November and December to be looking for COVID. There was no test, and nobody thought, perhaps we should look at what's happening. Now we're talking hundreds of thousands of people in between the time that a novel SARS virus was identified in China. I believe that's November 17th. And by that time, there were already tens of thousands of surplus cases, these cases that are sitting on top of seasonal flu. They tested negative for the seasonal flu. We know they're not the seasonal flu, and they're running at twice the rate of the previous 2 flu seasons. So we have a mysterious flu-like illness in the United States, and we have a novel SARS virus discovered in China. For the next 6 weeks, people are transiting back and forth. They're coming from China on flights, tens of thousands of people a week. To think that the virus that had already been identified in China, that we know is highly contagious, somehow missed 500,000 flights between China and the United States sounds implausible at best.
Right.
Ken, let's pause it right there. And, again, I think it's important, just beginning stage of assessing where the virus actually started and maybe some missed things of fall last year. What are your thoughts?
Well, I think the first thing you got to go to is Wen Liang, the Chinese whistleblower doctor, who believes that the virus started back in November. He warned his fellow physicians on the 30th of December and was subsequently then arrested. The Chinese government then tried to force him to signed a paper saying that he was spreading false rumors. He refused to do that. He went missing. And then all of a sudden, you find out that he got the COVID-19, died, and then CCP officials went and made a public apology to his wife and family. So they knew, even China knew, or at least had knowledge of it going back to November, which means that how many flights, or how long was it going on before then during the flu season? As you saw from the graph from this video, in California, it started to spike in about November 5th or so. And of course, California, like New York, is one of those anomalies in the United States because they are international hubs. Everything coming from Asia will come to there. Everything coming from Europe goes to New York, etc. So, you know, that's why California and New York have been two of the biggest hits. Seattle's another one where they get a lot from the Pacific Rim, a lot of flights coming in.
Yeah, and if you look at some of the reporting that's coming specifically from China, I was able to track back actual articles dated back to December of last year, where they were still trying to assess what was taking place with these pneumonia cases, and that's how it was originally reported. This is from the China Daily. Viral pneumonia cases reported in central China. It looks like at that time period they tried to assess what exactly they were looking at. Still trying to determine, and that's when they were able to research the infections, and they're still waiting under the way for the actual pathogens. Now, interesting enough, if we go to the WHO website, which is coming under a lot of scrutiny lately, the World Health Organization, the WHO did put out a statement dating back to January 9th, as early as that year, alerting, knowing that Chinese authorities made a preliminary determination of a novel coronavirus identified in a hospitalized person with pneumonia in Wuhan. So you look at the sequence of this. So it looks like that from the initial stages where they were trying to identify these pneumonia cases in their hospitals to notifying the WHO that, hey, look, there's something potentially happening here. They were able to research further, determine that, hey, you know what, we are looking at something different. So again, I think that timeline is interesting to determine, how this information came forth, who is shared, but there are documents to kind of see the paper trail, if you will, of when they started alerting people, the awareness that was started to raise early, Ken.
Yeah, absolutely. And I'm going to share my screen here real quick. And I'm going to point some articles that this actually, one of the biggest, remember the first rumor that came out? Let me go ahead and do the share screen and switch over. Okay. If you remember when the first came over, take a look at this going back to 2015. Let me know when you got it up there.
Okay, it's up.
A SARS-like cluster of circulating bat coronaviruses shows potential for human emergence. You remember that was the first thing that they said. It was contracted by somebody eating a bat in the warm markets of Wuhan. Okay, so somewhere, somehow, the rumors started going out that this was tied to bats. Now, like I said, this right here, this SARS virus, was actually first researched and studied at the University of North Carolina. Then it was transferred over to, let's see.
What's the date on that?
It was transferred over to China.
What's the date on those two previous?
This is from the NCBI, National Library of Medicine, published on 2015, November 9th. This is where it first originated. And then what ended up happening was China then took samples of the virus and moved it to Wuhan because it was ordered that University of North Carolina was no longer supposed to mess with this. That's when it moved over to Wuhan. And that's why all of this has started with Wuhan. Now, we're not going to debate over whether it was purposely leaked. It was leaked somehow from the lab, or it was purposely set loose by the West to try to screw China and this and that. Either way, it appears that this strain did originate in Wuhan, and that's what suddenly came out, and because of its rapid contagion, was able to shoot across the world. And the important thing, of course, is since China was primarily doing the testing on it and the research, the CDC has been behind the curve for a long, long time because they're more interested in studying global warming and obesity. They were not prepared at all for this type of virus or this type of influenza to come out, and that's why they were way behind the curve. And you have to question the World Health Organization why in January they downplayed it, as you showed in your article. They mentioned it a little bit, but they downplayed it. And even when it started getting some traction in early March, the World Health Organization refused to call it a pandemic until a certain point. What was that certain point? That's really a key question. You got to take a look at all the players in this. Fauci pops up. Bill Gates all of a sudden pops up. The World Health Organization calls it a pandemic. Really, you have not heard that much from true Chinese officials, and you have not heard from, except outside of the mainstream globalist doctors who are doing this, you're not hearing some of the information. That's why this Big Tree video is so important.
Yeah, let's continue this conversation again, because I think it's going to talk a little bit around why that initial date is important, especially as we navigate through this bend the curve, or I'm probably not even using the right terminology there. It's been changed so much. So let's let this discussion continue.
Preposterous if we look a little bit closer at this data. And so AJ began thinking that it was more likely that COVID emerged in China, became epidemic in Wuhan, transited with those passengers to the United States in November and December, and began spreading throughout the United States, unidentified, because people were either asymptomatic, mildly symptomatic, and we had no test to confirm their cases.
Which really, in many ways, is the conversation taking place right now, right? With Donald Trump withholding, financing of the WHO, saying there's real concern of whether we were warned on time. A lot of discussions by reporters all over the world. How long was China holding on to what they knew about this virus? Not only, saying that there appears to be a novel virus, but also weren't they withholding the idea that it could be transferred human to human, which is a big deal, right? It's one thing to have a virus that one person caught from an animal, but is it spreading human to human? There was a real delay, right, on us getting that information from China, which would lead to the fact that meanwhile, flights are going back and forth while over here we're living in some sort of lie.
It sounds like a popular question and an important question to me, but it's not the question that I'm really interested in, because we will not bring the country back online, and we won't reopen the healthcare system and restore the jobs for the nurses and the doctors that have been laid off by arguing about who lied back in November and December. So I'm still thinking forward looking. I'm still thinking, what is it going to take to reopen the Arizona hospitals and get AJK the scan of her liver tumor that she needs? What is it going to take for patients to have access to biopsies or mammograms or MRIs? I have another friend with multiple sclerosis. She needs an annual scan to see what the progression of her disease is, because multiple sclerosis does not get better. You can only try and treat the symptoms and slow the rate of progression. She cannot have that scan. And she can't have that scan because we have shut her out of the healthcare system. That is not a question of jobs. It's not a question of the economy or the unemployment rate or the stock market or who lied, or it's a question of lives of this type versus lives of that type. And right now, if we're going to reopen the economy, as I hope we do, a great place to start is to begin allowing those elective procedures, begin opening up the healthcare system to the people who need it.
I think that's a great point, and I don't mean to say that it's really the finger pointing is that matters, but what we are discussing is whether or not who said what or who said, it's really the question of when did this thing start, right? because as you pointed out, there's a great quote that that AJK, your co-author, wrote, I think, which is, it's important to remember the flat curve is not one in which no one gets infected. A flat curve is one which at its peak does not create enough critically ill patients to overwhelm the healthcare system. That peak dramatically changes if we move back the point of incidence or where this all began. Then we're in a totally different curve. It's not doing this, it's doing something more like this. And then we recognize that we really do have a better hold on the amount of cases that are coming in and a better understanding than we actually are letting ourselves believe, because if this is not a brand new event, we're in an emergency situation, but simply a progression that started much earlier, then we can recognize that our hospitals are going to be able to maintain and hold on and be able to bring services to all these other people that are now currently at risk. Am I laying that out correctly?
Correct. That's the way, Del. You are getting the gist of it, and you're understanding why it's important to know when the curve started. If we take the position that the appearance of COVID in the United States was January, and we watch the number of cases grow as fast as they were, confirmed cases, after we brought a test online, then it appears to us like the virus is growing much, much faster, because we're not accounting for the hidden cases that we couldn't test. It wasn't until January 12th that the RNA sequencing data was released by China. The first confirmed case outside China was January 13th. So what does that tell you? It must have escaped long before the RNA sequencing data was released. Now, if we miscalibrate our models, we will do a poor job of anticipating the height of the peak, the timing of the peak, and the policies that we enact to flatten a curve will be misguided. So those are important. But a new question that we haven't published has occurred to me, and I want to share it with you. There was this identification of a novel SARS virus in November by Chinese health authorities. Why didn't we pick it up? Why aren't we identifying novel viruses when they show up? Why is our CDC relying upon RNA sequencing data coming out of China in January 12th? Taiwan, evidently, if you believe their claim, they identified it in their country. They said, we're seeing something different and we're going to sequence it and find out what it is. But our CDC sat on these tens of thousands a week, influenza-like mysterious unexplained illnesses. And this is my field now. Healthcare is not my specialty. Resilient infrastructure is my specialty. And one of the essential aspects is you have to be able to sense and monitor what is going on in your environment. Our monitoring systems failed. To bring the economy back online, we need better monitoring systems. We need to be able to watch for outbreaks, for a second wave, and not just for COVID, but for any emergent disease. The next one could be superbacteria that are resistant to all of our known antibiotics. The question is, how will we sense what's going on in our environment? And why do we rely upon China to figure it out, inform the WHO, and then act on their data instead of developing our own? As an engineer concerned with our capacity to adapt in healthcare and all other infrastructure systems to surprise, this is a serious failing that we need to discuss.
I think it's a great point. I mean,
you can pause it right there, because I think that is a very legitimate question as to, why are we, not driving and getting that data, for ourselves. And there's a couple of examples of some potential things that, that we do need to, be concerned with, and, looking at, potentially not saying this was definitely COVID during this time, but you're able to go back and track articles of early of July of last year. And in this case, this happened in Springfield, Virginia, where there were a number of deaths associated with respiratory outbreak at a Fairfax County assisted living facility, has risen to 3. In fact, since the first case was reported on June 30th, 63 of the 263 residents at the Green Spring Retirement Community, a long-term care facility with assisted living, have become ill with respiratory risk systems ranging from upper cough to pneumonia. Health officials say that there have been 20 hospitalizations and 3 deaths associated with the outbreak. Health officials explain that they do not know the full medical history and the extent to which the respiratory illness contributed to the deaths. Then it goes on to say a specific case has not been identified and results of testing by the CDC are still pending. So, again, not saying that this was COVID back at this date, but for some reasons to question as to where was the conclusion, where was the follow-up to this. And then I'm gonna turn it over to you in a second. And then the last thing, I think we also need to go back, Ken, and also take a look back at the vaping lung illness, the 2019 to 2020. The vaping. There was an outbreak that occurred back in the time period of let's see here, April of 2019 to January of 2020. A total of 2,711 hospitalizations happened, including 60 deaths confirmed by the CDC. The cases peaked in September 2019 and have slowly been declining since then. Now, since then, the CDC did go on to state that they believe that there was a link to vaping products and vitamin E acetate as one of the culprits for this lung illness associated. But when you look at a lot of the symptoms that occurred with this vaping illness, they mirror or mimic some of the same things as COVID. So, again, not pointing fingers, not going to conspiracy thing, but trying to assess, the outbreak of this and when it occurred is just very key, Ken.
Yeah, I mean, it's great to always pull different scenarios, especially within a 12-month period of like that. I tend to believe that the vaping was primarily tied to over-the-counter, non-tested, non-licensed vaping products, because in the end, this is a respiratory flu virus. And so many different things mimic the respiratory problem. So, but going back to what you were saying about having advance notice, one of the things that stood out to me, and besides the fact that, or the big question, why didn't the CDC know? No, I personally think the CDC did know. I think the NIH did know. They purposely kept it from the public for a long time. And this is why I'm moving more and more towards the fact that they knew that this outbreak had occurred. I'm not going to say that they engineered it. I'm saying that they're doing the Ramen manual. Never let a crisis go to waste. This is why the true information did not come out until late February, early March. Why everything was, even look in the media. You saw the video that President Trump put out during one of his briefings, where he threw back at the media the fact that they downplayed it all through January, February, and into early March. They did it on purpose. They downplayed it on purpose, and now they're trying to accuse the president for political means. But two things that stood out. Right when the lockdown and the big push by the states, we were falling into that global financial collapse. Okay, so that's one thing right there. The second thing is, as I mentioned, back in December, Netflix comes out with a movie that was funded and executive produced by Bill Gates and Barack Obama, called Pandemic, which means that they had plenty of time if this really started coming out in late summer, early fall, a number of months. Well, the other thing is how would Bill Gates have access to the, if you want to go ahead and pull up my screenshot again here. This is an article that's put together, like you had, a number of different points. I'm not going to go through all because some of it does get conspiracy, but Bill Gates helped fund the Wuhan lab that was created in 2017. This Wuhan lab is where that SARS virus specimen moved when it went from North Carolina to China. It went to this new 2017 Wuhan lab. The other thing is Bill Gates was added to the Chinese Academy of Science. So he would have full access to what goes on in that lab and all the information. Now, the thing is where did this start? It goes back to the SARS coronavirus thing of 2003, where the NIH developed a man-made version using the bat DNA. Who runs the NIH? Fauci. Let's take a look real quick at Mr. Fauci. Here's a picture of him with some of the biggest globalists in the world. He's right here where I'm pointing. You have Bill Gates Sr., known eugenicist. You have David Rockefeller. You have George Soros. So, you know, he's been part of this system, and he is the leading person to what? To say that we should continue the lockdown. As a matter of fact, if you remember, first he said there would be millions of deaths. Now he's pulled back on that when it hasn't come to pass. Now, the other day, he said we need to see about locking down for about 18 months, which would completely, absolutely destroy the U.S. economy. It would also force individuals, or I'm going to go back here. It would also force the American people who would be stuck in this quarantine to be willing to accept anything, AKA the great vaccine they're trying to push at all costs, just to be able to get out of the house and to start working again. So, you know, more than anything, I'm in total agreement that this virus, for whatever reason, like I said, I have no information on how it escaped, but once it escaped, the knowledge of it was particular by China, by Gates, the Gates Foundation, by the NIH, by the CDC, and by the World Health Organization. They knew about it, and they didn't report the actual potential consequences of it hitting the world before, or several months before it actually got spread and is now infiltrated. That at this point, okay, they came out with tests. If they were to test every single American, I would bet that at least 1/5, 60 million, if not more, have the COVID-19 virus contained in them.
I wish you would have. Yeah, that's a great point, and we're starting to see some of that data unfold. There was two studies, one, or not studies, but testing, mass testing. There was one with the Navy ship, right, where a majority of them were. Do you have it up already? Do you have it in your tabs? So they test almost every personnel on this naval carrier, and long story short, majority of them tested positive for COVID-19, but absolutely had no symptoms at all. And the second mass testing occurred when in New Jersey, there was a homeless shelter. And so they went through and did a mass testing as there, and kind of the same findings. Several, I want to say well over 100 tested positive for COVID-19, but showed absolutely no symptoms of COVID. So very great point. Great point regarding that, Ken.
Yeah, that's the significant thing. This is not, I mean, they think about this. They want to treat this like the Spanish flu. The Spanish flu was, one, airborne. Two, it was much, much, much more virulent than what the coronavirus is doing. This is affecting people who would naturally be susceptible to any type of strong influenza. The interesting thing is, we saw the data where the curve started to really climb in November and December for number of deaths regarding the coronavirus. Well, guess what? We had something like 17,000 people die of what the CDC said was the normal flu before we even started counting the statistics for coronavirus. Yes, some of those could be COVID-19, but my guess is that there was probably the normal flu that was already raging through the world, and then this one also came in at the same time or immediately after, when the original influenza, annual influenza, started, hitting the downward spike of peak.
Correct.
But the key thing is in 2009, when we had the H1N1, 60 million people did test for it. We had 27,000 deaths. We didn't do anything. As a matter of fact, it was kind of interesting. What happened in 2009, 2010? They were pushing Obamacare. And this is one of the reasons why nothing was really done. They wanted people to get sick. They wanted people to scream for a global health care. Even that was used for political purposes.
Yeah, I get your point. I just I want to take it back a little bit and focus like on the timing and things of that nature. I again, the whole political landscape and all that. I totally get it. But I think for the purpose of the conversation, taking a look specifically at the failures of the CDC and how this is going to be played out in terms of thinking forward is how are the states going to get reopened? How are we going to get, similar back to some type of a normal type of a life? And right now it's very divided. We're a country divided on people saying, hey, it's time to start easing these things, getting back into it. We have another group that's saying absolutely not. We have to keep this locked down, June, July, all the speculation that's taken place. And we don't have the data, the information to really even, warrant where the initial information started. So let's continue this conversation a little bit and wrap this one up, this part of it.
Yeah. Hey, before you restart it,
yep.
I don't know if you saw what came from AG Barr today.
I did not. No.
This is from Attorney General Barr. These are very burdensome impingements on liberty, and we adopted them for the limited purpose of slowing the spread. You can't keep on feeding the patient chemotherapy and say we're killing the cancer, because we're getting to the point where we're killing the patient.
Yeah, absolutely. Absolutely.
Here and say China lied, but I think you assume all of our, top government agencies and healthcare agencies know that we never get good intel out of China. So to think that we have a system that relies on waiting for this country that has all sorts of reasons to not bring us the truth quick enough, I might take it a step further than you in that I have to imagine that there are, controls and abilities in place to detect those. I mean, when you said that, I told you earlier, I grew up in Boulder, Colorado, where we have NCAR and the National Atmospheric Research Center. We know where an earthquake happens in Thailand before Thailand does. I mean, the United States of America, I believe, has the best scientists in the world. We don't wait for information. We are set up with, in your area of specialty, with infrastructure, are we not, to understand every part of the things that affect our lives. I thought we were world leaders. It gets really disconcerting, I would hope you agree, when the world leaders start saying we're waiting on a nation that nobody trusts for their information.
I don't care whether they're trustworthy or whether they lied or whether they made a mistake or whether they're competent. I want that expertise inside the boundaries of our country. As you said, we have the best scientists in the world. For us to fail to identify early, monitor, and create our own data and our own test seems like an abrogation of our responsibility to our citizens. That's not something that we can live with next year, next flu season, next pandemic, next emergent infectious disease. So one of the lessons that we have already learned from COVID is that we need better systems to test, to monitor, to sense what is happening in our population's health. That includes emergent diseases, and it includes any other kind of, it doesn't have to be epidemic. As you pointed out, it's earthquakes, it's any other kind of hazard, it's hurricanes, it's tornadoes. We have the best sensing systems in the world when it comes to these environmental catastrophes. We have now been alerted that our sensing systems for health catastrophes are deficient. Let's fix it.
Great. So let me ask you a couple of the harder questions. I mean, as you know, the article that you published that you're a co-author on was pulled down off of Medium. That's something we're experiencing a lot where, someone will say that I was promoting an idea that COVID started back in November. I want to be clear that we're bringing you on that this is a theory that you've put forward. And to be very clear, you have not done testing of blood banks or anything like that all the way back in November of last year to determine that you're correct. It is possible there was some other event, whether maybe a rhinovirus or it could have been anything else that could have been this uptick of flu-like, flu-like symptoms, but didn't turn out to be the flu, correct?
Correct.
Okay, let me ask you but I think that what you're looking at, it's a great place to start. And what we try to do on this show is to do the research actively and allow people to understand how scientists think so that we're at the beginning of these conversations, not just at the end hearing, the story. I think it's really fascinating to see the things that people are looking at, scientists like yourself. But let me ask you the hard question, because I think anything that deals with this situation in America, I think the question would be, how do you explain the sort of what appears to be a sudden rise and dramatic rise in cases, in deaths in New York specifically? It just seems like over the last 3 weeks, We've gone from it's coming to people are dying everywhere, body bags lining up. What would be your explanation for how that happened in a model that should have been a much smoother model and had, maybe that was the peak? What is your explanation for what appears to be a real spike in New York?
New York is unique in many ways. When we do infrastructure modeling and we gather data on highways and transit systems and electric systems, we typically exclude New York because it is an outlier in so many respects: population density, infrastructure. We can't calibrate our infrastructure models for the country based upon what's happening in New York. I'm not trying to explain New York. I will leave it to other people who live in New York. The rest of New York belongs to America, but America is not New York. So the lessons that we could extract from New York will be taken out of context that do not apply to LA or to Phoenix or to Atlanta or to Denver, Colorado. Each local area has its own context, and we can only reason by analogy from a city like New York to a city like Seattle. I'm not going to speculate about what makes New York special in this case, but I will say that immunity, building immunity, tracking it, understanding who has it and at what level is the population immune is incredibly important. One of the things that is important to immunity against infection diseases is vitamin D. And I'm getting this out of the literature. I'm not a doctor. I'm just reading the papers about vitamin D, and I'm following some of the medical doctors who are saying this. New York and Seattle and Boston and other places that have been harder than my hometown of Phoenix are known for not getting a lot of sunshine. About 60% of the American population this time of year is vitamin D deficient. There could be a lot of reasons that relate to the immune system why Seattle and New York would be the places where the virus really takes hold, and it would spare a state like Arizona, comparatively speaking. We know that flu comes during the winter, and there's some environmental reasons for that. People packed indoors, the dryness of the air, the temperatures. One of the important reasons is in the Northern Hemisphere, we just don't get enough sunlight. We don't get enough vitamin D, and our immunity is down.
It's a great point. And obviously there's so many different confounding issues that need to be looked at when we retrospectively take a look back at what took place here. But I think you would agree, as we've been reporting on this show, the numbers that were speculated, the 500,000 deaths in UK and 2.2 million people in America. Sure, those were speculated based on, nobody doing anything as though nobody does anything. It's sort of using a fear tactic, I think. But we are so far below those numbers. In fact, every new model keeps dropping down. And now, apparently, our Surgeon General has said, okay, we've thrown away all those original models. And now we're down to actual data, which is, it seems to me, there was actual data present much earlier than where we're at. So, just to sort of finish this up, because I think it's a really fascinating issue, and looking at your graphs, there is definitely something that was happening last fall that we don't see. In your studies, you've gone back, I think it is 3 years. We went back and looked 10 years. We haven't seen anything like this. So there's definitely an anomaly going on. When you look at, obviously, we have a president. I don't care where people are at politically. That's not my question. The leader of this nation is listening to a lot of scientists right now and trying to understand how to move forward. What would be your message to Donald Trump right now? And as a scientist, sitting at a round table right now, what information do you think are, these great scientific minds that we have? What should they be doing? Should they be testing? What's our way out of this? And where do we get to the answers that you're looking for?
Everyone agrees that we cannot live with the status quo. People disagree about what to do about it, and they want to argue about how we got here. Because I'm an engineer, it's a design discipline. I work in my imagination, and I think about the things that I want to change. And here, No one wants to live with the status quo. I'm ready to recommend 4 things that need to change. The first one is we need to test, track, isolate. We need better sensing systems to identify emergent diseases. We need to develop our own tests that work and continue to improve them, both for COVID and any other disease that might emerge. That's the first one. We need the capacity to ramp up our healthcare system. Right now, healthcare is administered at the level of individual hospitals, individual cities. There is no national plan that can reallocate ventilators, reallocate staff to respond to a national crisis. And what this pandemic has revealed is that we need a larger scale system of ramping up our healthcare capacity in individual areas to those cities that are most in need, so that the resources can shift to the areas in which the needs are most acute. And we need to do that without shutting out people with non-COVID or non-pandemic related needs. We need to improve our understanding of antibody testing and build immunity. There are only 2 ways to do it: through vaccine or through exposure and recovery. Right now, we don't have a vaccine, despite the best efforts of some really bright people to develop one. I'm not against a vaccine. I just know that right now, the antibody testing is going to be a lot closer to coming online and being reliable than the vaccine will be. And we need immunity to this disease in our population. We need to track it and we need to foster it. The third thing that we need to do is adapt and learn a lot faster. When we get locked into a model like Neil Ferguson's at Imperial College, which came out in March, and we said, look, this is the best guess that we have, and you can't fault people for giving their best guess, but refuse to update it, refuse to back off of it, refuse to release the code to other scientists so that they could recreate it, we lose the capacity to adapt to surprise. That needs to be more open and more adaptive. There is no such thing as a right answer when you're building a model. There are an infinite number of answers, and they're all wrong, but some of them are useful. As you learn more information, you must update your models. We know from hurricane season that every time we turn on those beautiful color graphics of the path, there are 7 different models that show that it could land from New Orleans up to Washington, D.C. As the hurricane moves, the models reconcile, and we get a better idea of what to anticipate. That habit failed us in this case.
Great points. Thomas, thank you so much for taking the time to spend with us. We're going to continue to watch your work. I understand.
Again, just Ken, just specifically talking around the approach to this, right? And we witnessed the massive shutdown, the shutdown everything mentality, and there will be conversations moving forward that how this helped, how this it saved so much, but yet that time period, there's really no data to benchmark that. You can't say that necessarily that's a case. And my concern is that as we see this approach to this cookie cutter approach that we have to stay locked down, we can't start to reopen. We have to understand that needs to be lied within each state as we approach this. We can't take this type of New York mentality or Los Angeles mentality of that environment and those methods are going to work across every state. There's just no way.
No, we never should have. And there's a number of things that he mentioned and he spoke about. And when you think about it in a pragmatic, not in an idealistic, but a pragmatic way. Okay. And I hate to use the 2008 global financial crisis, but it's a perfect interlude. After coming out of that, all of a sudden there were all these things. Dodd-Frank was passed, the new Volcker rule, new gap accounting. We're gonna make sure that these banks fall in line. Well, guess what? After a few years, the politicians we're fine. The Fed's backstopping everything. We're not going to have another collapse. Janet Yellen, there's not going to be another collapse in my lifetime. And so people get lax and complacent. And all the safeguards that they supposedly put in get pushed away by lobbying, etc. Think about this. One of the funniest lines from the movie Live Free and Die Hard was when the hacker was trying to tell Bruce Willis's character about conspiracy theories, and of course, Bruce wasn't having anything about it. And he told him, he said, it took FEMA 7 days to get water to the Superdome. Well, guess what? FEMA has all the money in the world and is supposed to be prepared with regional places around the country to provide this, and they could airlift it in or do whatever, and they still can't. When he talks about putting in, mention about we've got to have ventilators that are in regional places around the country and be able to transfer back and forth, that's great. And you know what? That stuff's going to probably happen over the next 2 years. And then when there's no big epidemic for the next 5 to 10 years, those ventilators are going to be passed on to local hospitals. Politicians are going to use the stuff as they see fit, and it's going to become lax and complacent again. That's humanity. That's the problem, is when you don't have something that is as annual in this sense, then humanity gets lax, complacent, and greedy. So to try to prepare for that stuff, well, that's why we have a CDC. That's why we have an NIH. But unfortunately, guess what? They're big, bloated bureaucracies, and bureaucracies never are there to solve anything. Data models. The Fed has a data model. Look how well that's worked. The NIH had a data model. The World Health Organization had a data model. The CDC had a data model. They all failed. Why? Because you do not solve problems sitting in an ivory tower with theories. As they mentioned at the end, the engineer over there at ASU, when you have an original model, you have to be able to adapt it on the fly as new data comes in. And I really find it difficult that we have any agencies at all that are capable of doing this. And science is no longer about the scientific method. You know, the professor mentioned something. When you have a hypothesis, okay, you have your question. I observe something. Then you try to find anything there to debunk it. If you can't debunk it, then it becomes fact. But just like with science today, they do the opposite. They come to the conclusion, man-made global warming is killing the earth. And then they discount anything that would debunk it. So they're doing things backwards. They're doing the opposite. They're coming to a conclusion first instead of an observation. And that's the problem here with this with the virus, the influenza, or just about anything. You could package it into anything. A crisis comes, it suddenly doesn't fit into their theories and models, and they're too incompetent, or they overreact to be able to solve it.
Very, very well said. And I do want to touch base, because I think it is important that you said a lot of things, and especially in regards to humanity and moving forward. And it's something that we all need to really open up our thoughts a little bit of thinking how this is impacting, everything ranging from the economies to those individuals who are struggling to put food on the table, and be mindful of that versus so much of the politicizing that's occurring again, the people that are, want to continue to leverage this for political gain. There's no reason at this time period that should even be in consideration. We should be thinking about our neighbors, our friends, just, the people that are really struggling right now, to assess things. And if we don't start thinking that in that manner, then it's going to be very difficult for us to pick up the pieces and move again, Ken.
Yeah, the most important thing is just like what we've done here at the Gadfly, or what we did, some of us previously at Rogue Money, or with our own sites. We've been trying to say that individual preparation is the only way to do it. Your job is not to rely upon the government. Your job is not to rely upon experts. Your job is not to rely upon the states to be able to solve problems when they come. They're incapable of doing it. If you want to avoid most influenzas, well, get your immune system up, and don't do it after the fact. You do it before. Individual preparation is something that people can stick with, rather than rely upon government agencies to be there, like Allstate, like a good neighbor. We're there, or State Farm, we're there. No, they're not there. And in the end, they're politicians. They're going to use they're going to put on a facade of we're helping you. But in the end, what they're doing is they're using the crisis to help themselves and to further their own gains, especially during this election year.
Yeah, absolutely. Very well said. Ken, thank you for a great discussion today. And for our Gadfly subscribers, thank you for supporting our Gadfly multi-channel network. If this is your first time tuning in to one of the Gadfly multi-channels, please consider jumping over to our site, the gadfly.vhx.tv. It's in the description of this video, where you can find out about our premium content that we have listed there. So, Ken, any closing thoughts?
No, I think you covered it really good. And this is going to be an ongoing thing. So people need to get on board the Gadfly, because we've got so many different views, so much information coming in to try to help you make your own decisions.
Very well said. Thank you, Ken.